Welcome to this space dedicated to the dissemination of scientific knowledge, designed for medical specialists and students, as well as the general public interested in healthcare. Today, we will analyze a fundamental research paper titled Pulmonary Thromboembolism, Associated with Glioblastoma Multiforme, Imaging Diagnosis of a Case and Literature Review. This important article was developed by researchers Roldán-Valadez, Salazar-Landa, and Alva-López. Originally published in 2003, this study offers a critical perspective on one of the most dangerous complications in patients with brain tumors. Join us as we discover how the use of advanced imaging technology can mean the difference between life and death in these clinical cases. Legal disclaimer: this material is for educational and scientific dissemination purposes only. Its goal is to democratize access to the knowledge generated in specialized academic publications. Due to the dynamic nature of medical science, the information presented reflects the data available at the time of the original article's publication and may be subject to subsequent updates. Not medical advice. Under no circumstances does the information presented constitute a medical recommendation. The graphic resources used are only a representation of the article presented and are not completely accurate to human anatomy. For more information, you may pause the video.
Welcome to The Explainer. Today, we're diving into what feels like a medical thriller. It's a story where the fight against a brain tumor takes a terrifying, unexpected turn, and we'll uncover how a threat in the brain can silently launch a deadly attack on the lungs. All right, let's get right into this medical mystery. It doesn't start with dry statistics, but with a real patient in a real crisis. We're going to unpack a case where the battle against brain cancer was suddenly blindsided by a new, quiet, and even more immediate threat.
But before we meet our patient, it's really important to get a handle on just how common this hidden threat actually is. Because the numbers, well, they reveal a pretty startling pattern for patients who are battling brain cancer. Now this number, 120 per 100,000, might not seem like a lot at first glance, but it represents the yearly number of brain cancer patients who develop these dangerous, life-threatening blood clots. And here's why that number is so incredibly alarming.
And there it is. This is not some rare one-in-a-million complication. For patients fighting brain tumors, the risk of developing these clots is exceptionally high. It's a massive concern for both doctors and their patients.
So let's zoom in from that big picture and see how this threat plays out in the real world. This is the story of a 64-year-old man, and his medical journey took a sudden, dramatic turn that nobody saw coming. So for over a month, the fight was focused right here, on the brain. Radiation, steroids, the whole 9 yards. But then, boom, day 35. The battlefield completely shifts. A new, terrifying crisis erupts in his lungs, and it has nothing to do with the cancer spreading.
Now this is where things get really tricky for the doctors. Take a look. On one side you have the patient's actual symptoms. On the other, the classic triad you read about in textbooks. They don't really match up, do they? And get this, that classic triad, it shows up in less than 20% of cases. That makes diagnosing this an absolute nightmare. So with these really confusing symptoms, the medical team had to basically become detectives. But their very first clue was totally misleading, forcing them to look for evidence that was hidden in plain sight.
This is such a critical point. The first, most common imaging test they ran showed absolutely nothing wrong. To the naked eye, his lungs looked perfectly fine. All this did was deepen the mystery and prove that the standard playbook just wasn't going to work here.
But a specific blood test told a completely different story. They tested for something called D-dimer. It's basically a little footprint that a blood clot leaves behind in the blood. The normal limit is under 500. His result? 4,000. That's 8 times the normal limit. Okay, now that is a massive red flag. Something is seriously wrong with his clotting system.
That alarming blood test meant they had to bring out the big guns, the spiral CT scan. Think of it like this. A regular X-ray is like a flat photograph. A spiral CT builds a detailed 3D map of the chest, letting doctors see right inside the arteries.
And there it is, the smoking gun. This is the aha moment for the entire team. Those dark areas you see, the filling defects, those are massive clots just clogging up the artery. And that tram track appearance, it shows clots literally lining the walls of the blood vessel. The evidence was just undeniable. So, the mystery was solved. The diagnosis, a massive pulmonary thromboembolism, In other words, huge blood clots, which probably started in his leg, had traveled all the way to his lungs, creating a life-threatening roadblock in his arteries.
So now we know what happened. But that leads to the really critical question of why it happened. Why are patients with this specific kind of brain tumor so vulnerable to this exact problem?
The answer lies in this condition called hypercoagulability. It sounds complicated, but really, it just means that the blood becomes dangerously prone to clotting. It's like the body's clotting system gets stuck in overdrive, and it's all triggered by the cancer itself.
This slide shows you the four-step chain reaction. First, the tumor itself starts pumping out a protein called tissue factor. Then, that protein acts like a starting pistol for the body's entire clotting system. This creates a body-wide state where blood is just much more likely to clot. And to make matters even worse, the very steroids used to treat the brain tumor also promote clotting. It's a dangerous combination that creates the perfect storm for disaster.
So, what does this whole medical detective story teach us about patient care? What are the crucial lessons that we can pull from a case like this one?
This powerful statement from the source material really highlights the central danger here. A pulmonary embolism doesn't always announce itself with classic, obvious signs. It can be subtle, it can be easily mistaken for something else, and that's what makes it a silent killer.
So here are the key takeaways. We learned that symptoms can be really deceptive, and those classic signs are actually pretty rare. For high-risk patients, doctors have to be detectives. They have to constantly suspect the possibility of a clot. And finally, it shows that having the right tool, like a spiral CT scan, isn't just helpful, it's absolutely critical for getting a fast, accurate diagnosis.
This case is such a stark reminder that in medicine, the most obvious threat isn't always the deadliest. It leaves us with a critical question for both doctors and patients. When you're fighting a known enemy like cancer, how do you stay vigilant against its silent, hidden accomplices? The answer, as we've seen, can be the difference between life and death.
The reference for the article from which this information was extracted is displayed on the screen. Thank you very much for your attention and for joining us until the end of this analysis. If you found this review helpful, we invite you to share it with colleagues, residents, students, and anyone interested in these topics. Don't forget to subscribe and turn on notifications. This material is for educational and scientific dissemination purposes only.